The insights of health reform advocate, Dr. Tony Leachon. Doc Tony, thank you so much for joining us. In your view, is the COVID-19 situation with these numbers that we have right now over the past 13 days revealing that it is under control?
Yeah, we must admit that the cases are going down, but we're not yet sure whether this would be a reflection of the whole country. Remember that the positivity rate, less than 5%, is mostly carried by the National Capital Region. We know that the testings and of course our vaccination efforts are centered on the National Capital Region, and this would account for about 40 to 50% of the effort. So we're not sure all over the country whether this is the situation. So I should say that we should not declare victory too soon. But it gives us silver linings and sandbags that we can sail through another surge just in case there would be, a replica of what's happening right now in the US as well as in Europe.
But
So,
Doctor, can we really compare ourselves to Europe, the United States? Because in the Western countries, many of their citizens, although vaccinated, are not wearing masks, while we continue to wear our face masks.
That's correct. But, mobility is a major concern. And you know that during the holiday season, the temperature will drop. That will increase the viral transmission. So even if it is colder in the US as well as in Europe, the transmission rate is actually increased all around the world. And we are not exempted from that. So what I say is that even if we are wearing our face mask, but our vaccination rate is around 36% nationally. And we have not yet vaccinated about 70 million of the Filipinos and 40% of the senior citizens. If you look at the Department of Health data, and I'd like to zero in, and perhaps a lot of people are not actually looking at this. You look at the active cases, which is actually at 17,000, below 20,000. That's good news. But the mild cases, Rico, is right now 52.7%. It used to be 90% mild. And you look at the critical cases, 6%, severe 14%, and moderate 22%, for a total of 42%.
Right.
So it means to say the deaths are increasing even if you have low cases. This may be backlog, but the active cases would point out that we have serious critical cases in the midst of a lower case numbers right
but
now. So
Doctor,
we need to put that.
this rising number of deaths, yes, you have mentioned, and I've also noticed, has been triple digits, no? Over the past several weeks. Is this because a lot of these people who pass on are unvaccinated?
That's correct, Rico. Majority of our senior citizens, 40% are actually unvaccinated. And the vaccine hesitancy is actually increased also in the senior citizen groups and those with comorbid conditions. So this is the greatest challenge for us right now. Because even if you remember, our peak was 26,000 sometime in August and September. Our number of deaths is basically in the same vicinity as we have right now, even if we have less than 1,000. So we need to take a closer look because we need really to enhance the vaccination in the senior citizens. That's the A2 group, and of course the A3, which is the comorbid condition. And we don't have problem here, perhaps in the National Capital Region, but the peripheral areas, you can see the average vaccination rate is around 30% to 40%. And that's a huge number that we have to fill in.
November 29, 30, December 1, Doc Tony, our National Vaccination Day, no? And we already have a supply of close to 140 million vaccines. Do you think with this vaccination days and with the supply that we have, we'll be able to attain population protection sooner rather than later? And when do you think will that materialize?
I think we have to commend the government for doing the national vaccination schedule slated November 29 to December 1. because they're targeting 15 million. And I think with the 36 million that we have plus 15 million, we're close to having around 50% people's protection. I think we will be able to achieve this by December, and then try to give boosters for the priority group. And then if we maintain, this is just my suggestion, if we just maintain the alert level 2 the whole of December while vaccinating the whole population, we have a decrease in the positivity rate less than 5%, and then we have 50% vaccination rate, then we will be able to sail through whatever surge we will have in the next quarter next year.
But Doc Tony, shouldn't every day be National Vaccination Day? Shouldn't we really ramp up the immunization of our kababayans to 1.5 million or even 2 million a day? Can we achieve this on a daily basis?
That's correct. I think the move of the government to push it on November 29 is basically based on the volume of the samples that we have right now. We have right now a huge supply, and this is the right time to jumpstart. I think this is a jumpstart event. So every day after December 1 should be a national vaccination day, because the sooner that we actually vaccinate 50% to 70% of the population with a positivity rate less than 5%,
Right.
I think we're on our way really to our socioeconomic recovery.
Dr. Tony Leachon, thank you so much for your insights and for joining us on The Final Word.